Dr. Kalumbi Shangula, in his keynote address read by the governor of the Zambezi Region, Alfea Sampofu, said that the theme encapsulates the dual objectives of eradicating the stigma associated with leprosy and promoting the dignity of people affected by the disease.
Just the disease that is forgotten, but the people too. Every day, nearly 600 more people are diagnosed with and start treatment for leprosy. In 2022 alone, worldwide, Southeast Asia reported 124,377 new cases of leprosy, contributing to the worldwide statistic of 179,059 new cases of leprosy that year. Leprosy, also known as Hansen's disease, is a curable chronic infectious disease, and it is estimated that millions more go undiagnosed. This is no different in Namibia.
He added that the Ministry of Health has been vigilant in recognizing signs and symptoms of the disease. The day also included a visit to Nyambe Mushwaule, one of the affected residents residing in Movisa, who has been suffering from leprosy since 2014. It took years for medical professionals to diagnose him with leprosy.
I could not walk. I had to be helped with movement, even with just moving outside to sit under the tree. I had to be helped for me to get there, even when I go to the hospital. I was put on a wheelchair until they administered tests by cutting a piece of my skin to take to the lab, because they could not detect the disease through blood test, but rather through the skin. So when I began treatment, I was finally able to start walking again. I'm able to do light chores and work now, but without staying too long under the sun, because when I do, it feels like I'm melting.
Dr. Douglas Musweu, Senior Medical Officer at the Katima Mulilo State Hospital, reiterated that the number of cases recorded do not reflect the reality on the ground, and that there is a need to restructure programs aimed at awareness and treatment, as more still needs to be done in terms of funding.
We find ourselves in a situation where cases fluctuate. Okay. Leprosy in Namibia currently right now is endemic, so it's classified as an endemic disease, so it is there within our midst, mostly in the northern part of the country, that means Zambezi Region. We are the ones who probably clocking in numbers.
Juliet Sveso, NBC News, Katima Mulilo.